Welcome to Youth Health Transition Initiative. My name is Tim Markle. I'm director of the Wisconsin Youth Health Transition Initiative, and this is part of our video series on Wisconsin school nurses and the important role they play in healthcare transition. Today, we have Louise Wilson, who will be talking to us about the school nurses' role in healthcare transition. And Louise, thank you so much for being here today. We're looking forward to hearing what you have to say.
All right. Well, thank you for having me. And as you know, Tim, I am nothing but an advocate for school nurses because school nurses, I think, are the best advocates for children with healthcare needs and without healthcare needs. And so I'm always glad to be being able to talk about what school nurses do, and then maybe to provide them with a little information so that they can, possibly do their job better and feel more confident in what they're doing for children. So I am Louise Wilson. I am the school nurse health services consultant at the Wisconsin Department of Public Instruction. So today I'm going to talk about healthcare transition. I was reviewing an article on transition planning for youth with special healthcare needs in Illinois school. And that article pointed out that with current advances in medicine and healthcare, increasing numbers of children are surviving chronic health conditions and other disabilities, so that we find more youth with special healthcare needs, or YSHCN as it's often called, in schools and adult populations. And this has created a need for more focus on their health needs and the impact on their education. So youth with special healthcare needs are living longer and age out of pediatric services. The transition to adult health care is often particularly challenging for an aspect of the transition process for these youth and children with special health care needs. In Wisconsin, it's estimated that 558,000, or 20.7% of children aged 0 to 17 have special health care needs. I find that number just really staggering. And that number and that data comes from the Data and Resource Center for Child and Adolescent Health 2022 data. So DPI's School Nursing Handbook, Chapter 8, Education Services for Children and Youth with Special Healthcare Needs, was published last April. And it provides school nurses with a lot of information on working with children and youth with special healthcare needs, but it doesn't go into transition planning. So I'm really glad to have this conversation today. I think school nurses and the value they bring to students' education and health is misunderstood often and often overlooked. School nurses are the bridge between the education and healthcare systems. They understand both and can help students and families and staff navigate both systems. School nurses really are the only people on the education side that know what the healthcare system looks like for students with medical conditions or developmental disabilities and their families. They may not be experts in every health condition or in each post-graduation setting, but they can anticipate the types of challenges students will have due to their health condition or disability. They can make sure there are self-care skills built into the IEP if that's appropriate for a particular student. School nurses should be part of the IEP team whenever the student has health needs or a chronic health condition. School nurses are the team member with the most knowledge, besides the parents, about the particular health condition or disability, and they're the team member that can translate how the condition affects the student's ability to function in school and learn. Teachers may be able to identify or know the gaps the student has in learning, but school nurses can explain what it is about the health condition that may be contributing to that gap. Goals around transitioning, especially healthcare transition, can be written into an IEP. School nurses write nursing care plans for students with complex health conditions, much like nurses working in hospitals have a nursing care plan for individual patients and their unique health condition or needs. These individualized healthcare plans, or IHPs, have student goals, and some of them might be directed towards transitioning to more independence. School nurses, with their focus on independence and self-care, can play an integral role in the transition process for students. School nurses, knowing the health condition, the challenges, and what the treatment plan is for that student, can help the IEP team write realistic transition goals. Some of the transition needs of students, besides learning how to manage their health condition on their own or with assistance from others, include learning how to communicate with healthcare providers or finding an adult-oriented healthcare provider, managing medications and treatments, being able to provide a health history, and obtaining and using health insurance. Not all of these needs might be addressed in an IEP, but certainly if a student has a communication goal, the aspect of transitioning and being able to communicate their health needs to others is appropriate to include. The transitions flyers has some great ideas to get school nurses started. Talk with students about how to ask their healthcare provider questions. Help students learn to describe their symptoms. Help them learn their healthcare provider's name. Help students learn about their diagnosis. Encourage students to spend time alone with their healthcare provider. Help them put emergency contacts in their phone. Use time set aside for parent-teacher conferences to meet with students and their caregivers to discuss healthcare transition and changes in consent and privacy. I found an article posted to your Healthcare Transitions webpage on challenges youth with chronic medical needs face, and I quote, "Adolescents and young adults living with chronic medical disabilities are at a critical and potentially arduous point in their lives. Financial independence looms, and their future autonomy, security, and quality of life hang in the balance. Higher education is often an opportunity for competitive, integrated employment. But while young people with chronic conditions have equal numbers of high school graduation rates compared to their healthy peers, they are only half as likely to graduate from college. Students with chronic medical disabilities face unique challenges that create barriers to the higher education opportunities they desperately need. Such barriers include, but are not limited to, having an invisible or non-apparent condition, the unpredictability and fluctuating severity of many chronic medical conditions, and an inherent lack of education and understanding of chronic medical disabilities by university staff and administrators." End quote. So really, Tim, school nurses are about removing health barriers to students' education and succeeding in school. So it really just seems logical that school nurses be involved in preparing students to graduate and know really how to manage their healthcare needs in a post-high school world. So again, that's kind of my end of my little spiel, but again, advocate for school nurses, advocate for school nurses advocating for their students. And I just think that transition planning is one of those things where are areas really that school nurses can shine and therefore should be part of the IEP teams and do that. So thanks for the opportunity to do my little spiel.
Well, thank you so much, Luis. And it reminds me of a saying that you've heard me talk about before, and that's trying to look at where does the need that you see in the world intersect with the skills that you've been given. And school nurses are at that awesome intersection of education and health to be able to enable the students to grow in self-determination and advocacy, to learn about their health, to learn about how to take care of their health so they can maintain it for their health years. So the school nurses are just at this brilliant intersection with the skills and the needs of their students with disabilities and special health care needs.
I couldn't agree more with you, Tim. So I really appreciate that. And I appreciate the opportunity. And I appreciate the resources that your network and organization is doing to supply school nurses so that they feel more confident in their ability to do that. So thanks.
Absolutely. And so this video will be posted on the Health Transition website, Youth Health Transition Initiative website, under the Wisconsin School Nurses tab, along with other resources that Louise mentioned during the video. So we hope you'll check those out. Thank you so much, and we'll have more videos coming up.
Thanks.